Hi, it's Sarah here, your neighborhood doctor of physical therapy. This video was requested by one subscriber, but I'm certain that he's not the only person that fits these descriptors. Let me show you what I would do for a 97-year-old man with a very arthritic left knee who's having trouble standing up from a chair. So we're doing something a little bit different today. Today I have my beautiful grandmother here to help me demonstrate the exercises. The first thing I would do for someone who has an arthritic knee having difficulty standing up is I would put a hot pack to the knee. I would make sure there's either a layer of clothing or a washcloth in between the hot pack and the skin. And I would put the hot pack right on the knee, right on the painful joint for about 15 minutes. And what this is doing is it's improving blood flow to the area as well as improving joint mobility. The next thing I would do was I would instruct this patient on something called quad sets. So I would take this hot pack off, and what you do is you're squeezing this muscle right here, your quadricep muscle. So if you imagine my hand is underneath your knee, I want you to push your knee down into my hand, squishing my hand. Yep, see how she does that? And relax. So you're not raising your knee up in the air. Instead, you're just pushing down, very small movement, maybe even no movement, and then relax. So let's do 10 of those together. Okay, go ahead. And 1, and relax. Good. You're holding for about a 1 Mississippi. 2 Mississippi, and relax. Yep, 3 Mississippi, and relax. Yep, keep going. 4 Mississippi, and relax. 5 Mississippi, and relax. 6, 7, 8, 9, and 1 more. Good. So we're just activating the muscle that is involved in knee motion here. The next exercise that I would work on is a side-lying hip abduction. So what this is we're going to be working on the muscles in the glute area here to raise the leg up. And the reason why we're doing that for someone with an arthritic knee that has a hard time standing up is because it's both your quadriceps and your glute muscles that are responsible for sit to stand. So these are exercises we're doing to support and strengthen those muscles in a comfortable position. So what we're going to do is have you raise this whole leg up in the air and then back down. That's perfect. We're going to try 5 of those. Okay, raise up 1 and down, 2 and down. Yep, keep on going. 3. That's right, that's perfect. 4, and keep breathing the whole time. And 1 more is 5. Great, great. And do you feel that in this area? Okay, good. Now, you can start off with both of the knees bent. This is a shorter lever arm, we call it in physical therapy. So it's a little easier if your knees are bent. However, if you've been doing this exercise for a little while and you want to challenge yourself further, you can go ahead and straighten this knee. Try to keep your hips stacked on top of each other. Now, can you raise this leg up a little bit? Good, and down. It's hard. That's a hard one. See if we can do 2 more. Raise up and down. Perfect. And 1 more. Raise that straight leg up and down. Notice she's keeping her kneecap and her toes pointing straight ahead. She's not allowing her leg to rotate. She's not allowing her knee or her toes to point up towards the ceiling. They're always pointing straight ahead. The next exercise I would do is a long arc quad, and that's just a fancy name for straightening out your knee in the sitting down position. So can you straighten out your knee slowly like you're kicking a soccer ball in slow motion? Yep, and then let it down with control. Let's try 10 of these. We'll go right ahead. Yep, up and down. 1, 2, 3. And this is just giving her some practice in range of motion at the knee. 5, 6, and she's breathing the whole time. She's listening to her body. If something is hurting her or bothering her, she would stop, or she would do less of that exercise. I think this is 9.
10.
Oh, that was 10. Oh, she knows. It was 10. Okay, great. So we're showing you these exercises on a couch, but many people would do this exercise routine in bed right away when they wake up in the morning, and you could also do these exercises throughout the day. The next exercise that I would do is just moving sitting to standing from a chair, the actual activity that is tough. So what we have here is we have a pillow behind for a little extra support, and we have a cushion underneath her to build up the height of the surface of the chair. We know that it's always easiest to stand from a high, firm surface, so that's where you would want to start. It's harder to stand from a lower, squishy surface. Now I will caution you that many people will put pillows underneath the seat of the chair to build up the height. However, please use caution because I have seen people slide off of the chair when sitting on pillows. So if you have a cushion that has a grippy surface on one side, or perhaps a cushion that has the ties that you could tie to the back of the chair, those are two things that you can look into if you need to build up the height of the chair. But what we'll do here is you're already scooted to the front of the chair, which is great. You can press with your hands on either armrest, nose over toes, and come up to a stand. Great. And then reach back down to sit. Great. We'll try to do 4 more of those, please.
Okay. Whoops.
Yeah. Great. That's right. 3. And 1 more. Good. So with all of these exercises, please listen to your body. Try to do the exercises perhaps 10 times each exercise. However, if a certain exercise is more difficult or is painful, feel free to do less of that exercise or use less range of motion for that exercise. One of the keys to dealing with arthritis is to keep the joint moving throughout the day. Although resting the joint does make the joint feel better, if you keep it still for a prolonged period of time, like if my grandmother here was sitting in this chair for several hours not moving her knee, and then she got up and went to walk around, her knee would likely feel stiff, compared to if she was going to be sitting for a while and every once in a while she did the exercise where she straightened out her knee. So go ahead and do that. Can you straighten out your knee and down? If she did a couple of repetitions of those while she's sitting, it will keep her knee more mobile. Thank you so much for watching this video. Please like and subscribe to this YouTube channel and let me know any other content you would like to see in the future.